I'm Ian McCall. I'm a professor of surgery in the University of London, Guy's Hospital.
My name is Shane Duffy. I'm a consultant obstetrician and gynaecologist based at Chelsea Westminster Hospital here in London. I also chair the Royal College Global Collaboration Committee, and I'm also a fistula surgeon, and I work in Uganda.
And I'm a member of the House of Lords. I've been there for 25 years, and I speak often about fistulae and medical matters.
Fistula is an abnormal communication, a hole that develops between the bladder and the vagina, or it can be an abnormal communication between the bowel and the vagina. And this abnormal communication gives rise to constant leaking of urine or constant leaking of bowel contents.
What happens is that the lady goes into labour. Often they are very young, not fully developed, and the pelvis is too small. Baby gets stuck in labour and often dies, and the pressure on the side wall inside makes a hole in the bladder. And so they then, after the baby is born, dead, there's a hole between the bladder and the vagina, and so they leak urine. Yes. And there can sometimes be a leak from the rectum as well, so they may be doubly incontinent. And then their troubles really start. The husband usually chucks them out the house, the villagers won't have them in the village, and they are complete outcasts. It's a great tragedy.
Yes, I think it is. There's an enormous amount of work to be done, however. So worldwide, there's over about 1 to 2 million women that currently have a fistula. And every year there's approximately 100,000 new fistulas occurring. And unfortunately, the background of the amount of surgeries that we're doing is very little. So annually, we only do approximately 16,000 fistula repairs a year. So you can see up to 2 million occurring, or that currently exist, 100,000 new fistulas every year, and we're only doing about 16,000 fistula repairs a year. So there are many strategies that need to be implemented in order to affect this, ranging from community projects to surgical projects and prevention projects. But if you bring all of those together, I think, yes, we can make a significant impact.
It is possible to cure quite a large number of them.
The preventative arm of Born is something that I feel passionate that we try and develop, and we have a catheter study which is potentially going to prevent at least 20% of fistulas worldwide.
Some of them, the damage is so extensive that they need to have further advanced surgery, and that can be done as well. I got involved with Mercy Ships about 15 years ago, and I thought, as we were in Africa and there were so many of these fistula patients, that Mercy Ships should get involved. And we go into port for 6 months or even a year and do all the operations they can't do. But the great emphasis is on teaching people to do the operation. There's no good us going in and doing an operation then coming away. We must leave something behind.
Born is a collaboration between the maternity department here at Chelsea and Westminster and the Chelsea and Westminster Health Charity, and it's a collaboration to try and improve women's health not only here in the UK but also abroad. And our international work, one of the work streams that we've got is to try and train surgeons to be able to repair fistulas, and we've also got a prevention arm that we're developing in order to prevent the fistulas happening in the future. Yes. I'm extremely fortunate to be able to help people, and at the very essence of what doctors and midwives and nurses do is caring for people, we're in a very privileged position to be able to make a real impact on patients' lives, to make them better, to try and help them in some way.
The way to do it is to institute proper obstetrics throughout the world.
Well, I think people have been aware, and politicians have been aware, that there are strategies like the prevention arm and catheter study that I talked about. So it's training surgeons to do the operation is great and it needs to happen, but actually moving forward we need to be able to come up with strategies to be able to prevent fistulas, and I think that's where the future exists in.